only 6 muscles you test in cerebral palsy in lower limb. So in hip, you test your iliopsoas, or mainly psoas muscles, either with a Thomas test or a Stahel test. You do your rectus femoris test by Duncan-Ely, and you do for your adductor test, and you do for Gracilis the flap test, and we describe all these tests. How do you interpret these tests? All these things we have described in the clinical examination. In the knee, you do. So in the hip, you do for psoas, for rectus, for adductor, for Gracilis, 4 muscles. And in the knee, you're doing for hamstrings and quadricep. So 6 muscles. And in the foot and ankle, you test the gastrocnemius by silver scored test. So these are the tests you do mainly for describing a cerebral palsy. And then if they want detailed examination of foot, then sometime they may ask you to test for tibialis anterior, posterior, and peroneal muscles, depending on where the deformity is that. They may ask you that. But these are the 6, 7 muscles you have to test. Okay, so hip, knee, and foot and ankle, we said. And then we also test for torsional deformity of the femur and tibia. And the femur we do for excessive anteversion, and you'll have to do prone test with what is the hip range of movements, and you do Craig test to see how the trochanter get prominent to assess your excessive anteversion. And for tibia, you do your thigh foot angle and intermalleolar axis assessments. And the foot, you assess the deformity and few muscles if it is foot deformity they're talking about. So this is what you need to do in the examination. And then comes the examiner may say, any other investigation you want to do it after your history, gait, anatomical, physiological type, and assessing these 6, 7 muscles, then any other investigation. So the investigation is depend on if you're suspecting torsion deformities, either femur or tibia, then you can assess those deformity by CT scan. So torsional deformity can be assessed by CT. If you got severe flexion adduction contracture of the hip joint and you're suspecting that hip is dislocating or a risk of dislocation, then you do a pelvis X-ray with both hips to calculate the Reimer index, and we discuss that in detail. Then those are the investigation, plain X-ray and a CT. And for foot deformity also, whether there's a mid-foot break or not, you do a plain X-ray, weight-bearing X-ray. Then if there is a availability, then it will help if you can do a lab gait analysis. What we did just now is observational gait analysis. You can do a lab gait analysis, which is the instrumental gait analysis, where they put a lot of marker on the femur, on the tibia, on the different metatarsal, on the pelvis, on the spine. And the computer can tell you how much flexion in the hip joint happening in the stance phase, swing phase, and give you exactly the gait pattern and which muscle is firing. Simultaneously, you do EMG also of these muscles. So which muscle is firing, which is not firing, you do that also. But that won't be asked you too much because availability is not there in most of the centers. So imaging, 3D gait analysis, and very important examination under anesthesia, because sometimes it's very difficult. We mentioned in our examination when, especially for hamstring and gastrocnemius, that you should always do R1 and R2 and then tell the examiner how much is contracture and how much is contributed by spasticity. And again, if you want to go and last week lecture or last 2 weeks lecture, go through and see how do we differentiate how does we interpret R1 and R2, and that is done mainly for 2 muscle, hamstring and gastrocnemius, because our hip is very difficult to do that. But those are the 2 muscles you do R1, R2, and then differentiate between spasticity versus true contracture. And if you are still doubt, then you put this child to sleep, and most of the time the whole spasticity will disappear when child go. Then you know whether it's pure contracture or spasticity. So the third thing is EUA. So what are the 3 investigation you do? You do X-rays or CT scan, you do gait analysis, and you do EUA.